Welcome to Healing Minds, Stories of Resiliency and Recovery, a conversation held at the intersection of substance abuse, mental health, and everyday living. Your hosts, Marc Regala and Justin Wolf, bring both professional expertise and personal understanding to the table. So welcome to the conversation. Let's dive in.
Hi, everybody. Welcome back to another episode of Healing Minds, Stories of Resiliency and Recovery. I'm your host, Justin Wolf, joined by my co-host, as always, Marc Regala. How you doing, Marc?
Doing good. How about yourself, Justin?
Doing great. We got a great guest with us today, Sam from Doctors of Physical Therapy. He is a physical therapist. How you doing, Sam?
I'm doing really well. Thank you, Justin.
Awesome. So, Sam, I'm not sure if you're aware of, but this is the time in our show where Marc provides us and our listeners with a weather update about what is happening this time of year. So, Marc, please.
No weather update. No weather update today. So, middle of May, we're in the middle of Mental Health Awareness Month. NAMI, DuPage specifically, is celebrating their 40th anniversary this month of the organization being originated by several moms back in 1985. Got a big gala in a couple days, May 17th, here in Naperville. It's got a lot of awareness going on when it comes to mental health and addiction services and so forth. So it's a busy month. Very busy month.
Definitely. Thanks, Marc. No, I think it's a great segue. We're kind of talking about this being Mental Health Awareness Month. We have Sam here, who's a physical therapist working for Doctors of Physical Therapy, who really can kind of speak on really this unique program that you kind of built in terms of mind, body, and just that connection between physical wellness and mental wellness and how these two are not separate but go in hand. So, Sam, if you would, man, just kind of share with us a little bit about where you got the idea for this program and kind of what this all entails.
Thanks, Justin. I could talk about this for hours on end, and I probably will keep going if you guys don't cut me off. So I started my career, I graduated 2012 with my doctorate, and I moved out of state. I did pediatrics for almost my entire career. That kind of morphed into pediatric sport, pediatric chronic pain. I moved out to California. I did a little bit more pediatric chronic pain and started to notice that there was a huge mental health component to chronic pain. So I started digging in a little bit more. I ended up moving back to Wisconsin in 2020, just in time for COVID. And then I got on board with Children's Wisconsin, and they had partnered with Rogers Mental and Behavioral Health Programming. And they were going to create an intensive program for teenagers aged 13 to 18 with chronic pain and mental health diagnoses. It was a intensive program, so 5 days a week, 8 hours a day, 4 to 6 weeks in the program. They would get one-on-one PT every single day of the week. We did group physical therapy every day of the week, up to 6 kids in the program. And after the first year in that program, I mean, like, it blew the lid off of the concept of physical therapy and mental health, which prior to that, I knew it could play a role, but I didn't know how profound of a role it could play in mental health. And so working alongside mental health providers, so I worked with experiential therapists, psychologists, psychiatrists, pain med physicians, mental health specialists, counselors, and working alongside them and just being able to sit in on some of their sessions, getting specific training from them, being able to train some of them in terms of what I do in physical therapy and how it isn't just like, exercise with the kids or PE class for the kids, because it really couldn't be further. Though sometimes we did do some PT type exercises and activities, but it really just shone a light on how important physical therapy can be in terms of treating mental health, but it has to be done right, and it has to be done in conjunction with mental health providers. So I spent another year there, and I stepped away because the program was amazing and it was great, but it was so limited because it only ages 13 to 18. And I'm like, well, where do the 20-year-olds go? Where do the 12-year-olds go? Where do the 50-year-olds go? And what about the people that can't commit to a 5-day-a-week, 8-hour-a-day program? What if they can only commit to outpatient services? What if they don't need that level of care where they need it every single day? So I started kind of packaging this outpatient program. And in Doctors of Physical Therapy, people say, oh, it's Sam's program. He came up with this. And I wish that was the case. I wish I could take credit or say, hey, I was creative and I thought of this, I invented this. I didn't. I just took stuff that's been working around the world for a long time, and I put it together into the Mind Body program. And decided, I think that we can find a special sort of niche. I think that we can open the doors to mental health. In 2020, the American Physical Therapy Association wrote it into our Practice Act that they took the stance that it is within our scope to be able to treat mental health diagnoses. So things like anxiety, depression, history of trauma, eating disorder, etc., in conjunction with a mental health provider. So essentially what it is you're seeing your mental health provider for anxiety or depression or whatever. And your provider refers you to physical therapy. And everyone knows PT is good for you, right? It helps you get back to exercise. It helps you move more, makes you stronger. And that's great. But when you have, really debilitative anxiety or depression, you can't even make your physical therapy appointments because you're anxious about what's going to happen. Or maybe you had it in the past and it went over, like a lead balloon. You were in pain for days after. It's just like it wasn't being done the right way. And so this program trains physical therapists how to work in conjunction with a mental health provider and help assist in that management in a way that really works. And it works phenomenally. So the mental health provider says, okay, go see Sam for physical therapy. Well, I see patients in physical therapy that get referred for back pain or a post-knee replacement, or they blew out their ACL or tore their Achilles. There is always a mental and emotional component to that. And so I say, who do you have that helps you with that component? I help you get the muscles stronger. I help you get your core stronger and make that thing heal a little bit faster. But who helps you with the emotional and mental side of this? So that's when I refer to a mental health provider. And when you have that teamwork and that network, people just get better so much faster. And I see it firsthand. I see it every day. And it just really works. So that was kind of my thought process for this program. So I pitched it to Doctors of Physical Therapy in 2023. They brought me on board to pilot it. I did it in my own clinic in Wauwatosa, Wisconsin for a little while. Started going really, really well. I networked with some local mental health providers, a group of counselors. I had a meeting with the CEO in February of 2024. He loved it. He said, let's pilot it in a small phase first. So I had 2 other clinicians and 2 other clinics come on board. So we had a clinic out in Stoughton, which is just outside Madison. And then we had a clinic up in Mequon, which is a northern suburb of Milwaukee. And they really took off with it. It went over really, really well. It went over so well that this past January, we entered second phase of pilot. So we expanded the program to Michigan and Illinois markets, and then several other markets here in Wisconsin. So now we've got probably 6 times the therapists that we had doing it. It's going really, really well. We're making some great connections. Our patients, we're starting to get referrals from mental health providers. We're referring out for mental health therapies. And so I have another meeting set up with our CEO coming up. Eventually, we're going to try to expand it nationally now this summer. So that's kind of my path.
It sounds like incredible work, man.
Yeah, I mean, it's been a lot of work. I love it. I'm fortunate enough to be on board with a company that they're really progressive. It's a big company, so they just acquired 56 more clinics in Florida, Arizona, New Mexico, and California. We were at 100, now we're at 156 throughout the Midwest, and then Florida, and then the West Coast. Which it sounds like a big company, but the company is run where the clinicians are really allowed the freedom to operate at our highest potential. So the CEO saw the potential in this program. He let me pilot it. We proved that it works. We got the ability to spread our wings a little bit. We spread it out a little bit more. It's working really, really well. It's run, I always tell people it's run like a small company, like a small business, where the CEO will, he'll send you texts, like you can text him and he texts you back, and I'm just a PT, I'm just one guy in this company. But it really is, it's a progressive company, and having the ability to have time built into my schedule to promote and continue to build this program is super important to me, because the research that's coming out on what we can do as physical therapists for mental health is really moving, at the speed of light. I've adapted the training modules in a year, and we've evolved them based on research that's come out in December of last year, January of this last year. Literally March, last month, a new paper came out talking about things that we can do as physical therapists that directly impact anxiety and a couple other things.
That's awesome. That's incredible, man. And I'm just kind of curious, because you're talking about, like, hey, as a physical therapist or doctor of physical therapy here, you're getting additional training in the ability to recognize different mental health diagnoses in terms of like anxiety, post-traumatic stress disorder, depression. Could you talk a little bit about kind of like that training, because that's so critical and important? So just kind of share what that was like for you guys, man.
The training is, so we do specific training in the mind-body programming because, as physical therapists, we always care about people's mental health. We care about people's well-being. You don't Most people don't get into being a physical therapist for the massive amounts of money. It's not that kind of
Oh,
job.
the fame and the glamour wasn't the driving force.
Yeah, all the bright lights and the glitz. Yep. Yeah, that doesn't happen usually. But we all know that exercise, movement, eating healthy, the normal things, those make you mentally healthy. They make you physically healthy. When you're physically healthier, you're mentally healthier. When you're mentally healthier, you're physically healthier. But we've kind of been doing things the same way we've always done. So we get someone in, they've got chronic back pain, maybe they're overweight, they're highly sedentary, they get chronic migraines, they have neck pain, they've got a history of surgeries. Oh, well, we know they need to exercise, right? Everyone knows that. They know that. So we stick them on a treadmill, we get them on a bike or whatever for 10 minutes, 20 minutes, and then they never come back because they end up paying for it for a week. They're like, I tried that and I ended up on my back for a week because I was in so much pain. And it's just, we've been doing it kind of the wrong way for a long time. What we needed was just some definitive research that shows that let's flip it. Let's switch this. Let's do things totally differently than the way we've been doing them. And maybe this is going to work. And while the research is there from other countries, now the research is there from here in the US, that if we do things differently, we have much better outcomes, like mind-blowingly different outcomes with these people. These people that haven't exercised in years and years and years are going back to exercising. I had a woman that hadn't exercised in years. She goes to the gym now on a regular basis. And that's like that's a Tuesday for me. Like, it happens so often using this programming.
Yeah.
And it's just a totally different way of going about it, but it is specialized. So when I went through the work with Children's and Rogers, like, I sought out advice. Like, I sat in on counseling sessions, on psychology sessions, on group therapy sessions, and learned so much. And then as part of mind body training, I brought in counselors, psychologists, sports psychologists, eating disorder specialists to be a part of these modules and our monthly meetings. And we have a great group of mental health specialists that offer their insight and their training, where we can say, hey, we're working with this demographic. What are things that we need to know? And we're hearing it from the horse's mouth. So it's not just like, well, Sam read a research paper and this is what we got. This is like real mental health providers, doctors of psychology, counselors, people with lots of experience are giving their input and helping to train PTs, and vice versa. We're giving them training that they can use in their sessions to help their people get back to movement.
And I feel like this is kind of like that new wave, right? Like we're kind of breaking down these barriers or these beliefs that have been kind of well ingrained into like systems and structures that are really kind of providing services. So how did you go about, like, what was really helpful for you in really kind of carrying this message to break down some of those like systemic barriers that you might have come up against when you're looking at really incorporating this into mental health treatment and recovery?
Well, I mean, even physical therapists, mental health specialists, when I say, yeah, physical therapists, we can now treat mental health. The number one question is, well, like, how? What do you do? Like, you're not I was out to dinner with a group of friends, and like a good group of friends, the people that know what I'm doing. And one guy asked me, he's like, yeah, but how does physical therapists like treat mental health? Because you're not like, these are his words. He goes, you're not like a therapist. And I'm like, it's literally in the title of our physical therapist. But I know what he meant. And he's right, is we don't think of physical therapy in terms of helping mental health. We think of it in terms of the physical world, the orthopedic world,
Right.
Knee replacements, orthopedic surgeries, post-op neuro rehab. We hold mental and physical health in America in these two separate silos. And really, we need to start looking at it as one whole silo. And like I mentioned, that Venn diagram I have as part of my training, where we have mental health and physical health, and then there's a little overlap in the middle. That's usually how we see it. And how we need to see it is these two circles completely overlapping, because there really is nothing that will ever affect you physically that doesn't have some sort of mental or emotional impact or toll, and vice versa. Someone calls you a name when you're 9 years old. Well, there's a physical impact to that. There's electrical activity in the brain. Maybe there's a little bit of blood cortisol that gets released. So there's always an impact on both sides, and you absolutely cannot have one without the other. And helping people to see exactly how we can have both of those and hold those both in the same style, that's been very critical to the success of the program. And there are still people, I think the younger generation, typically, in my experience, tends to be more open to mental health. So depending on where you are in the country, certain demographics, I had one lady literally say, I said, who do you talk to about some of this stuff? How do you deal with, the emotional impact? You were doing all these things, and then you got this injury, and then you have this arthritis, and you've been pulled out of those things. So who helps you unpack all that? And her response to me was, oh, Sam, I won't swear on the podcast. She goes, I don't believe in that psych, what?
Yeah.
And And that's so overcoming those barriers has been challenging. But I will say the help of the mental health providers, so the counselors and psychologists that I've been working with, they offer the PTs, feedback on, how can we navigate that? How can we bring that up organically with our patients so that when we refer them for mental health services, so I got someone comes in for bilateral knee replacements or, a history of pain or whatever, I say, hey, I think you should go see a counselor. Like, it doesn't come out like, hey, I think you're crazy, go talk to a counselor. And that's the last thing we want them to believe, because none of us believe that. But we do believe in the effect of mental health on physical health.
Marc, what do you think, man? Because I know this is like Marc's wheelhouse. If you've where unfortunately we have not seen him flex yet, but he will definitely preach about just how important shakes his head. Like how important physical taking care of his physical body has been in his own recovery program. So I'm just kind of curious, Marc, what's kind of running through your head, man?
Well, I was introduced Sam through one of his physical therapists, and when I heard about this program that was being introduced to their physical therapist and the training that they were going through, I was very intrigued because, and this is pretty well documented on this podcast. Yeah, I mean, I definitely had PTSD, anxiety, and depression issues, but never saw a therapist, until really I was in the weeds of my addiction. And how did I get addicted to opiate pain pills? Because of a neck and back issue. Because my diet was absolutely terrible. Exercise was non existent. I had no work life balance, very high stress in my life, gained a lot of weight. And, was referred to that surgeon in Naperville, Illinois, and had two conflicting test results. I had an MRI that did not show a pinched nerve and an EMG that did show a pinched nerve. And I was introduced to a pain management doctor, and the doctor prescribed, opiate pain medication as well as some muscle relaxers. In my opinion, probably a little too much. There's restrictions now and so forth, but that's ultimately how I got hooked on the pain meds. One, to provide relief on the physical pain, because I couldn't sleep in my bed for like 7 months next to my wife at the time. And all the stress it was creating during the day because of lack of sleep and trying to work and pain and things like that. But then just all the chaos that it actually caused, because I was dealing with anxiety before and I was dealing with depression before, and now it just enhanced the anxiety and depression because you were going through this physical pain and you couldn't get a good night's sleep and you just felt anxious, and you guys mentioned cortisol, the stress hormone and things like that. So, naturally, unfortunately, the progression was an addict's progression. I started taking them not as prescribed. One, to provide more relief from the pain, um, because my body was building up a tolerance, and two, probably to self-medicate because the underlying mental health that was going on as well, that was enhanced by the physical pain that I was under. And I think it's pretty well documented the destruction that it caused in my life. But then in recovery, I completely changed everything up, and I changed everything up really to address the addiction, my sobriety, and then the mental health component. But then I realized, and we've talked about this again, Justin, how the mental health is related to the physical health, because the same food that you got to put in your body to get your brain chemistry right, serotonin, dopamine, oxytocin, and endorphin levels, is the same food that you got to put in your body that's going to help build muscle. The exercise is going to help you elevate a lot of those mood altering chemicals in your brain as well. And that has really allowed me to keep my mental health in check, live in recovery, and I maintain my sobriety now for almost 5 years, off of everything. So, when I heard this, this really spoke to my soul because it is what I preach. You guys know all the medical terms. I'm just an insurance guy during the day and all that stuff, but that's pretty much what I tell people. When I'm working with an alcoholic or an addict and I'm trying to get them recovered and so forth. And I will say this: a lot of times when I am working with an alcoholic or an addict, they are dealing with aches and pains, and I deal with a lot of opiate addicts that were introduced to pain medication due to a physical ailment, and then you got an underlying mental health component. So this really does speak to my soul for sure. That's why I thought it was a good idea to bring Sam onto the podcast.
Definitely. No, because you hear about it all the time. And I think you've done a great job of kind of like documenting, speaking on it, Mark, where it's like, hey, just I don't feel comfortable in my own body, right? And I'm sure, Sam, you hear that a lot, where people just physically feel
Yeah.
uncomfortable being present with themselves and being in their own skin, and having to kind of help people kind of work towards that acceptance component of just being like, okay, like how do I kind of work on myself while also learning to kind of be comfortable being me and being able to sit there and be present without trying to find some way to get away from myself. Whether you're dealing with like anxiety, depression, or you're in the thralls of your addiction, like these are things that can kind of just like pull you in all these different directions. They're just trying to get away, avoid, and escape.
I agree. I really believe that there's research that supports this, but I call it a Sam fact. Okay. It's like Sam's brain. You can't have chronic pain without an underlying mental health cause. I think the same is true for substance abuse too, is like, there's a reason that we're having these pains. There's a reason that we're turning to these substances. And if you don't fix those underlying causes, we're never going to fix the problem. So when people come in and see us and they've had, a history of back pain and all this stuff, and it's like, okay, well, I just look at your back, I just look at your tummy or your knee or whatever. Like, we can't do that. We got to take a step back. And something always comes out, especially when I was working with the teenagers in the Children's Rogers program. It was, kids would come in, I'm fine, I don't have anxiety, or no trauma. And something always came out, always. They might not have been diagnosed, but you find out, well, they were actually, abused when they were younger, or, they do have a ton of anxiety. They just, deny it or mask it or whatever. And so I think there's always an underlying mental health condition. And if you can start to chip away at that or get help with that, then you start to see your patients start to get better. I'm talking from a physical therapy perspective. And so it's so important to involve mental health providers. I think every patient should get a referral, but that's how I feel. But like, there's always a mental health impact. So yeah, I think, Mark, you're dead on when you're talking about mental health issues. And then, I'm using this pain medication, and then I'm using it more than prescribed. And like, well, I had to deal with those underlying mental health components as I started to get my nutrition back on track. And the food, oh my gosh, we all know fruits and vegetables, all that, like everyone knows that. But when we start dealing with people with anxiety and, the role of artificial colors and preservatives, and I could get on that soapbox. I have a food as medicine certification. And oh man, when we start helping people get away from some of those things. And as PTs, we have sort of this unique, I don't want to say it's not like an ability, but we can see a person 2 or 3 or 4 times a week. Whereas sometimes, psychologists, mental health counselors, they might be able to see a person once a week. Physicians, you might only be able to see them once a month, and you've got 15, 20 minutes, but I've got an hour with you 3 times a week. Like, I've got the time with you to be able to break down and validate and say, okay, when you eat this chemical, this is how your brain responds. This is what happens in your tummy and your guts and stuff. Oh, you're having an anxiety attack. This is what happens in your brain physiologically. We break it down. And some of my favorite feedback to get is when patients say, oh, that makes total sense. Oh, that's why I feel better when I cut those things out of my diet. Or, oh, that's why my teenage son can play video games at home for 8 hours and never get a migraine, but he's at school for a half an hour and he immediately has to call home and get a migraine. And it's not an excuse, but it's an explanation. And that's what we, as PTs, we can really offer. I think that's unique to the field. Sorry, I got totally off track on that one, didn't I, Justin?
No, man, no, because I think you're kind of just really highlighting and speaking like this is just about wellness, overall wellness for people and taking care of ourselves. And it's just like we talk about kind of breaking down these walls and these barriers and just saying, hey, like this is the new day and age. Is like, how do I treat myself and take care of myself, knowing that, hey, just because I have this diagnosis, it doesn't mean that like I'm over here on the sidelines. Like, no, it's just normal. It's normal for people to go through difficult times in their lives. And there's going to be periods in our lives where a lot of us are going to meet criteria for a diagnosis, and it doesn't mean that we're defective. It just highlights the need to really kind of circle the wagons, call it what you want, right, and just kind of say, hey, what do I need to do here in this moment to make sure that I am supporting myself and taking care of myself to the fullness of my ability, making sure that I'm providing myself with those resources and connecting with individuals that can help guide me on this way out of this place that I currently find myself sitting in. And so it sounds like that's what you're able to kind of do now with this mind body program, is kind of connect some of these dots and kind of draw these linkages that previously were not being connected.
Absolutely. like nail on the head there, because I treat people and they come in and they say, I'm broken, and I go, what's going on? Where do you want to start? And they've got all the list of all the stuff that goes wrong. If I fall off a bike and scrape my knee, it doesn't mean I have bad skin or my skin is defective. It just means I got an injury now and we need to heal it. And I think the same is true for mental health. Is you can have mental sort of injuries. You go through anxiety or depression. It doesn't mean you're a broken person. Instead of focusing on, you go to the doctors and all your therapy visits and this and that, we're focusing on, well, let's fix your knee, let's fix your pain, or this hurts, that hurts. But like, sometimes we got to flip it and say, like, look at all the things you did right, and look at all the things that are healthy, and let's just take some time to take care of these things that need a little extra attention right now. Like in my knee skinning example, well, I put a Band-Aid on it to protect it so it doesn't get infected, and then it heals, and then my knee is back to normal. I think we can do similar things with mental health. It's just, maybe a little bit longer term, but it's not that the individual, there's nothing wrong with the person. It's just they have this symptom or this diagnosis, or this thing is going wrong right now, but the individual is not broken, the human.
Right. No, and I think that's kind of what ends up happening. Like for us as people, like we're problem solving machines. Like our body and our mind is always like, I got a problem. I need to figure out how to fix this. Right. So it's going to perseverate on those items or those things that just feel or appear to be off. Right. And it just kind of feeds the narrative in those times. Could you talk about maybe like one of the clients that you worked with where, you noticed maybe they were a little bit like more harsh or judgmental of themselves and like their condition, and kind of what the Mind Body program was able to offer and extend to them that kind of aided them in kind of learning to form a different relationship with themselves and talk a little bit more, compassionately and understanding to themselves instead of being so critical and judgmental.
So there's two. Whenever people ask that, give me like a patient that like a classic patient. There's two. There's one is a woman that came in. She started seeing us she actually saw a different therapist, valued for her shoulder. She had shoulder arthritis, so nothing related to mind body at all. And then the schedule didn't work out with his schedule, so she got put on my schedule. And so we're just treating shoulder. She's going to get ready for a shoulder replacement, and she's relatively young, in her 40s. And we just start talking, and I see these people like for 3 days a week, 2 to 3 days a week, hour each time. So you talk and you get to know the people. It's something as physical therapists, I think we offer that's therapeutic, not necessarily physically, but we can act as ears where they can talk and we listen. And so we started talking about some of her history of this, and when she had been inpatient for mental health diagnosis for 8 months, which is a really long time. And then so there's all this other stuff, history of trauma, and she got all this other pain. It turns out she had an FND, so a functional neurologic disorder, where she's got these twitches that are happening in her leg. And she had those since like 2004, full neural workup. We chalk it up to an FND, where there's nothing wrong neurologically with her, but she's getting these physical manifestations always when she's stressed, always when she's in a stressful environment. It wasn't like a Tourette syndrome or anything like that. And so the functional neurologic disorder. So I'm like, I think you might be a good candidate to kind of go through our mind body program. And so I talked to her a little bit about, she loved it. So we go through mind body program, and she's like really, really depressive, seeing an outpatient counselor. And so it took us probably 3 months to really get through and dig down. Okay, well, what's chronic pain that we're going to not accommodate? We're going to try to chip away at the condition response to that pain. What's an orthopedic pain? You're in your 40s, like when you're a teenagers sometimes have like a thing going on, but as the years go by, like my knees hurt, my back hurts, all this kind of stuff. And so which pains are we going to accommodate? And she kind of went back and forth on, I don't know. She would email me and say, hey, my back was really hurting this weekend. Do I accommodate it or not? In this process, she ended up tearing a ligament in her ankle. She slipped on ice. And so she had to have a surgery for that, put a screw in the ankle. So we're like, nope, we're going to accommodate this. This is orthopedic. This needs to heal. So we a lot of this, like, what do I accommodate? What don't I accommodate? And it was fantastic. So she slipped on ice for the initial injury. And then she ended up slipping again later this past winter on ice again, and didn't fall or anything, but it hurt her ankle. And I got an email from her. She said she ended up going into urgent care. They said I had strained the screw or whatever it was that was in the ankle. And she's like, I don't know if that was the right thing to do. And I'm like, so she came back in. I was like, you know what? Like, that's fantastic. I'm like, in this process, you have learned the difference between, my back is really sore today, it's hurting, but I'm going to go to the gym anyway. I'm going to do my 20 to 60 minutes of submaximal aerobic exercise. And I always feel better when I do that. And she does that. She had learned the difference. So she gained total independence in terms of what pain do I accommodate? What pain don't I accommodate? And she made the right call. And it was just fantastic. So she's one of my favorite cases of a patient that came in that was very anxious, very, I don't know what to do. If I accommodate this pain, am I ruining all the training that we've had? And very, figuratively hands-on to now hands-off. She makes the call on her own. And now she goes to the fitness center 3 or 4 days a week. She does her exercise. She's back to work part-time now. She works as a speech language pathologist. And I'm like, she's going to a concert this summer, some band that she used to really love, but hasn't seen in a couple of years because of the anxiety, the depression, and then being inpatient for 8 months. So like totally getting her life back on track, which is fantastic. That, I think she's my go-to example of like a patient that's really gaining independence that needed a lot of hand holding early on, but now it was like her life is getting back. And like, this isn't, wow, good job, Sam. Wow, you did physical therapy right. I mean, I worked with her counselor, her psychiatrist. So this is a team effort. And if you cut any one of those pieces out, I mean, the patients just don't get better the way that they would if they had all those components. So that's what kind of, she's my go-to example of just, when the PT can work with the mental health side and we can really tackle it from every angle, it just goes a lot further.
Right. Mark, what are you thinking over there?
No, honestly, I just think it comes down to education. And that's really what it comes down to. And that's what I like about this, because, when you do explain something, like when I speak at the hospital and I talk about everything is intertwined, the physical component and the mental component, people tend to grasp to that, once you start explaining that to them, or if I go speak at a church or an opioid event in Naperville with the DuPage County Sheriff, I explain a little bit about my history, explain a little bit about my mental health diagnosis, and then I talked about what my recovery looks like. And people understand that. And again, I will reiterate it. I did not have the education and knowledge up front. I kind of found it through trial and error. I mean, all my daily habits and all my lifestyle was focused on my mental health because my addiction got so severe and I was dealing with, the severe depression and things like that. But I guess my aha moment just came in when I started getting active in the gym and started realizing that the same, like I said, the same fuel that you got to put in your body and the same activities that you got to put in your body that's going to fuel your mind and get that chemistry to a therapeutic level so you can live a life of recovery with the anxiety and depression and so forth, and not use any type of addictive behavior, whether it's alcohol, substances, gambling, eating, whatever it might be, is going to affect the physical body in a very positive way. Because I didn't set out to lose all this weight. I didn't set out to get physically in shape. I wanted to beat my addiction, get in recovery, be sober, and get my mental health in check. All that came to secondary.
It's interesting when you say
all
that.
the feedback you get, man, from like taking care of yourself, right? Like, think about this, because like that's one of the things we tend to do just as people is like make excuses and justify why we can't show up for ourselves the way that we need to be showing up for ourselves. That would communicate, hey, I really care about me. Like we tend to fall to the back of the line when it comes to these things. And so naturally, when you're showing up and taking care of yourself in the idealized way, like naturally, you're going to get those positive things. And it's not, you're right, it's not what you set out, but it tends to be like the end result of what you get, where it leads to a much more fulfilling and satisfying life. Because when we're caught up in the thralls of all this, what happens to our world? It gets tighter, it gets smaller. We try to control everything in it, and it's all being driven by just the avoidance of whatever that distressing experience is that we just like refuse to have or don't want to have show up. And so now by actually learning, like you guys are kind of hitting on some huge things here, you're getting comfortable with yourself, you're taking care of yourself, you're showing up and treating yourself in a way that says like, hey, I actually care about the outcome of my own story here. And so I better make sure that I'm taking care of myself and putting in the time and energy in these areas that are really important. And look what I get, a much more fulfilling and personally satisfying life. That's critical. And sorry, Sam, you had something you wanted to throw in there.
No, what you're saying is I was going to echo it because it's so true. Some of the best results are, if people come see us as PTs, I'll see them 2 or 3 times a week. Marc, you talked about education. Our first few sessions, our first 3 or 4, sometimes 5 sessions, they don't even exercise. I literally have a whiteboard. I do it old school, and we walk them through this sort of mind-body programming. This is neuroanatomy. This is how pain works. This is how anxiety works. Whatever it is they're coming in for. We walk them through the catastrophization cycle. We walk through, what stress means, what that is, what's happening physically. Because if they come in and we say, okay, now you got to start exercising, you know how that goes over. So, but you're right. But just in Marc, when then we started gradually moving into exercise, right? And moving. And the mind body isn't just about exercise, but it's like a side effect as they start getting healthier because now they're moving more. And we always say in PT, we say if a joint isn't moving, it's dying. And your body's made up of, all these joints. So we want the whole thing to be moving. And they start moving, they start feeling better. The movement gets easier, so they do it more. So it feels better, so it gets easier, so they do it more. So it becomes a sort of positive cycle. And then on top of that, we kind of crack the whip and we hold them accountable. Because we tell them up front that, like, hey, you're going to start this program. You're excited. Great. It's all, rainbows and butterflies. You're going to work with Sam in physical therapy, with doctors of physical therapy. You might tell your friends. And if you don't show up for the sessions and you don't do the stuff that we're going to give you for home, we don't give big home exercise programs. You're going to say, I did this program. I'm working with Sam, but it's not working. Sam sucks. DPT sucks. This all sucks. They can't help me. And so I'm like, you have to commit. There is no reason for you not to show up to that. I don't care how bad your pain is. I don't care if it's a 15 out of 10. You got to come to therapy. If you have an anxiety, you have to show up to therapy. We can deal with those things in therapy. You have to come in. I used to say 104-degree fever or bone poking through the skin, go to the ER. Now I'm in Wisconsin, so I say, okay, if it's snowy outside, bone poking through the skin, 104-degree fever, fine. But for the most part, I don't care if it's a new pain, if it's the crazy pounding headache and you're seeing me for stomach pain, it doesn't matter because we can triage it. And if it's something that we feel like you need to go to the urgent care for, we will refer you to the urgent care. But a lot of times it's a newer symptom and we can hold them accountable. And so they come in, we go through some things and they're held much more accountable. The other patient that I usually tell people about is a really good example of that. So it was a 12-year-old girl. She was referred for the mind-body program, severe anxiety, history of anxiety. I treated her through the summer. This was last summer. We go through all the mind-body programming. Kid missed a ton of school the year before, just a ton. And so we had to set up first day of school's coming. We got a 504 plan. I worked with her school psychologist. She has a teacher liaison that's going to meet her the first day. She's been to the school. She knows where to go. Okay, a plan is in place. First day of school comes and the front desk gets a call. Hey, it's the mom. So-and-so's not going to school. So I'm like, oh, did you try to get in with her counselor? Can't because she's booked out for another week. Okay. So I look at my schedule. I got a couple of post-ops. I can have a tech work with her. Just bring her in. We'll 20, 30 minutes, whatever. We'll talk to her. Kid comes in. We review some of the programming. We do as PTs, are you guys familiar with transcutaneous auricular vagus nerve stimulation? So stimulating the ear for the vagus nerve, bring down anxiety. It's a newer concept. A huge systematic review was just published in December of last year. Basically, we dry needle an area of the ear, and there's a branch of the vagus nerve that innervates that ear. And it's now FDA approved for anxiety. You can dry needle it. You can e-stim it. There's specific e-stim devices. So she comes in. I needle her ears. We talk about some of the strategy. We do a check the facts. So I use some of the strategies that I talked to her therapist about to review with her. And the kid goes back to school. And when I checked, that day, went to school, finished the day. And when I checked in with them last Christmas, over Christmas break, the kid hadn't missed a day of school. Wow. And it's like, that was a perfect example of where we can step in real quick and we can needle the ear, bring down the anxiety in the moment, review some of those plans of action, kid goes back to school. And but she was held accountable. If it was just like, okay, we're going to miss the first day of school. Well, you know how that's going to go. She's going to miss a ton more school, right? So, but we held her accountable. And then she goes to school. And because she goes to school, her grades are great because the kid's super smart, brilliant kid. And so now she's got these fantastic grades. She's passing her classes. I haven't checked in with her since Christmas break, but that's an example of where the mental health component and PT component work together, and all these extra side consequences, the feeling healthier, losing weight. In this kid's example, she's a healthy body weight, but she got good grades because she's actually showing up for school, and she's in high school or getting ready to go to high school. So grades are pretty important. Anyway, a little bit of a tangent there on what we started talking about, but I think it fits in because when people do start taking care of themselves and they have people that can help hold them accountable, lifestyles start to change.
Mm-hmm.
exactly what I was going to say. I mean, you just you want to hold them accountable, and you want to create some discipline there. You want that discipline to become a habit, and ultimately, you want it to become a lifestyle.
Yes.
I mean, that's the end all goal. And if it becomes a lifestyle, then it's going to work hand in hand on the mental and the physical side. And you brought up a very good point very early in the podcast, and I want to reiterate this point. And it is true. I mean, you're seeing these patients 2 to 3 times per week, and you're seeing them in person. Where they might be seeing their therapist once a week, once every couple of weeks, and a lot of times now it's done virtually. So there is some value there for sure, especially creating a network with your physical therapist and like a clinical therapist like Justin, and be able to forge that relationship. I think that's absolutely huge.
It's vital. They have to sign off. If they're going to do mind body program, they have to sign off an ROI or release of information for me to be
Yeah.
able to communicate with their mental health provider. Because I mean, there's times when like they'll tell me stuff they don't tell their mental health provider, and then they tell their mental health provider stuff they don't tell me. And so getting the full story is very important. Not always, but that happens sometimes. But also, it's important for them to know too that, the things that they impact with their counselor, their psychologist, whoever, like they don't have to go through all that with me. They don't have to dig into that stuff again. I don't want to re-traumatize them, but I want their mental health provider to know exactly what we're working on in therapy. So as they go through their time with me in the mind body program, part of the mind body program, we talk about the catastrophization cycle, breaking that. We talk about medicalization, and we talk about like figuring out who is, I'm just going to use Sally. Sally's coming to see me for whatever. Like, who is Sally if she's not crippled by anxiety and she doesn't have debilitating stomach pain and migraines? Like, what did she used to do? And so I had a patient I just saw, I was seeing last fall, woman in her 60s. Her and her friends used to go out every Halloween. They'd dress up as witches, and they go to Wolski's. And they hadn't done it in years because she's in too much pain. She's too tired. And so it got to the point where she had started exercising again. She started moving it. And I'm like, okay, your homework then this Halloween is to go to Wolski's, dress up like witches with your friends, and just have a good time. Like, you have to go. I'm not telling you how long you have to go for, but that's your physical therapy homework. And then at your next meeting with your mental health provider, you're going to talk about what that looked like, what that felt like, or whatever. And she did it, and we could use PT. I'm like, you come and see me for an hour. We got to the point where, you're on the bike for 20 minutes, and then you're using and this is a woman in her 60s, using the TRX for some exercise. You're doing some body weight leg exercises. Like, what you're doing in physical therapy is way more physically exhausting than what you'd be doing, in Wolski's. And so, we check the facts. Your muscles are intact, your bones are intact, you're strong enough to do this. And so we can kind of use that as a very objective validation of like, okay, and she did it, and she had a great time, and it worked out really, really well. And we do that. That's kind of the end game in physical therapy, is like the homework becomes not, well, you need to ride the bike 3 times a week. It's okay. Well, you got to get back to who you are, and that's really where like the mental health provider really, like, they take over, and they help them figure out. A lot of the counselors I work with, that's my favorite part of my job, is when I help someone figure out like who they are if they're not this diagnosis and this diagnosis, getting back to that personality.
And you're thinking out loud right here, but you start talking about, okay, so let's say somebody's dealing with anxiety, general anxiety disorder, and let's say they got major depressive disorder, and now they have these physical ailments as well, and maybe now they had to have some type of surgery, or they got to take some time off of work to tend to these physical ailments. Everything is going to be elevated, especially with the financial stress that we're feeling as a society right now. So now their anxiety is going to be even more elevated. Maybe the depression is going to be even more elevated because they're feeling the financial strain at home, because maybe they're only working part time and making part of the income, or maybe they're not able to work at all. And if they're not able to work at all, then it comes down to whether or not they got some type of income replacement through their benefits through work. So you got that added component as well. So I mean, I think that's huge. I mean, and then the other thing is we start talking about. I always talk about being selfish. And I always say when it comes to your physical health and your mental health, that is one area that is 100% okay to be selfish, and you have to be selfish because you can't be the best partner, best spouse, best parent, best employee unless you got those two in check. And I always tell people, like, from my perspective, my first goal is what I got to do to make it through the day sober. That's a day by day thing. And then what do you do? What do you need to do to have a good mental health day? And usually it starts with the gym. And I actually refer to the gym as a therapy session in the morning. I really do. I mean, I always say I start my day with the therapy session in the morning because it just does. I mean, it just gets my mind straight for the day. It just relaxes me. It reduces my anxiety. It's a good exercise. It gets the body moving. And that's just how the base is set every single day. I've been doing that for a while now. So I'm a big believer and a big fan of this.
The exercise component is huge. And when people come in to physical therapy, they get referred with anxiety or whatever, they usually picture like, oh, we're going to be exercising. And when I say the word exercise, people have, images. And so what I tell people is our job is to get back to 20 to 60. This is the World Health Organization recommendation, 20 to 60 minutes, submaximal aerobic exercise, uninterrupted. It's not like crushing a new PR on the stair climber. It's not, bench pressing. This is just like mindless light cardio to get that serotonin and endorphin drip in your brain.
Yeah.
Like, it's not enough to make your muscles sore. I mean, there's sometimes a ramp up phase if people have been really sedentary, but we build, part of my job in physical therapy is helping them get to that point. And then the rule is you absolutely have to, I don't care what else is going on in your life, you have to hit 3 to 5 days a week of that submaximal aerobic exercise. It doesn't matter. The only reason not to is if you're really sick, a death in the family, maybe, but like you have to get that. I don't care how you feel, because I'll have patients. They'll say, I just don't feel, I'm feeling really tired, and I'll say, when's the last time you exercised? And they'll say, 5 days ago. I'm like, we're behind. I'm like, then we're going to spend the first 20 minutes and we're going to get on the bike. I'm like, I don't care how you feel. I say it usually in a nicer way, but the truth is I do care about how they feel. But I care about how they feel after they do this exercise, because I want them I know that they're going to feel better. If we do nothing, and they go home or they don't come to PT, they're going to continue to feel like garbage. But
Yeah.
I'm going to knock on wood. Every time people say, yeah, my pain's really bad, say a lot, I'm really tired. Every time we get on the bike and we just do 20 minutes mindless cardio, we're talking about what they did the weekend, talking about what I did the weekend. They get off. I'm like, so what's, and they're like, yeah, you were right. Adults will give you the satisfaction. They'll say, yeah, you were right. Teenagers never will. They won't give you the satisfaction. They'll be like, no, I feel worse. I'm like, that's bullcrap. But
That's great. That's great. No, it's been an incredible conversation. I think you brought a lot of great stuff in terms of like what you've been able to share with us from the Mind Body program that you're offering at DPT. I know Mark has been trumpeting this, so I'm glad to hear kind of just like what this is like in practice, because I think it is so powerful. Like we all have like our own live life experience of just how important working out and exercise is, and knowing the difference between like how do I feel after I work out versus days where I don't work out. Like there's a profound difference in just like mood and energy levels. So I think the fact that you're able to kind of bring like this data and this research into this program and apply it to really empower people in their lives and get into living the lifestyle that they want to be living for themselves, which I mean just increases people's own sense of their own ability to set out and be successful in whatever it is that they achieve. And it also helps lift their mood in the process. So that's incredible work you're doing there, Sam. Anything else you'd like to share about the program before we call it a day here?
I mean, I really appreciate the opportunity to talk about it. Justin and Marc, if you guys gave me like 12 hours and just said, hey, ramble about mind body for 12 hours, I could fill that time. Like there's so much that I haven't covered. I just like the program is fantastic. And the things that we're seeing in clinic that we weren't seeing, 10 years ago, 5 years ago, it's amazing. And I do the program 100% selfishly. It's all for my own gain, because when I'm working with these patients, they're so debilitated and I see them getting better. They're getting back to stuff that they hadn't done in years. The kid missed all this school last year, and then she went back to school this year. Another kid, I gave her mom press needles to put in her ears. She's having a total meltdown. An hour later, the mom sends me an email, says, oh, now she's back to working on her project and she's totally calm. Like it feels so good here that like, I love doing it. So I love watching these people get better and get back to their lives. And when they're doing stuff that they haven't done for 15 years, and it's just, like I said, it's totally selfish. I get a really good feeling out of it. It's amazing. It's physical therapy. So it's not like this is a specialized program, but it's not like you need a specific referral or anything for it. You just go to a mind body trained physical therapist, and they know what to do. We bill it under physical therapy. It goes through insurance. So it's not like it's I don't know, alternative anything. But no, I just really appreciate the opportunity to come and talk about it. I can't thank you guys enough for having me on today.
Excellent. Marc, you got any closing thoughts? I know this is
No, the program is excellent. That's why I thought it was good to have Sam on as a guest. I mean, really, it encompasses everything we've talked about for 2 years on these podcasts in one podcast right here, if you think about it.
Very true. Very true. Thank you, Sam. Thank you, Marc. And as always, thank you, everybody, for tuning in. These podcasts air on the 1st and the 15th of the month, so go ahead and tune in. If there's topics, areas you'd like to see us dive into and explore, feel free to email us. Marc checks our email on a regular basis, so that's one of his duty. He's like, thank you for assigning me that. Yeah. But feel free to tune in. And as always, thank you for listening. We will catch you on the next episode, everybody. Thank you.
Take care.
Thanks for joining us today on Healing Minds, Stories of Resiliency and Recovery. If you're on the journey to find guidance and insights, subscribe now wherever you find your podcasts. Healing Minds, Stories of Resiliency and Recovery is an educational resource, not a substitute for medical or therapeutic advice. The opinions expressed by the hosts and their guests are not necessarily those of NAMI DuPage. Go to namidupage.org/podcast for links to past episodes, show notes, and to submit a question or topic ideas for a future episode. Until next time, be well.